So, Vivian, one should look at the idea of partners, like with the health department, everything, distribution, warehouse, retail, where you get your ingredients from, so many different partners, if you will, as part of a big team. And as part of a team, that whole team needs to work together.
Yeah, absolutely. At this critical moment at the recall, when people's already been sick and more people could get sick, the only way to solve a problem is for everyone to work together as a team, even though there's a lot of emotions going on, a lot of concerns going on, but let's focus back on protecting the consumer, the public health, and that's the only goal that we will work on it as a team together. So,
So, that team would need a clear plan,
mm-hmm.
clear communication,
Yep.
strong leadership,
Mm-hmm.
and even within that team, trust.
Absolutely, an open mind.
I was going to ask you if there's any more ingredients. So, an open mind.
An open mind,
Any
because
other
sometimes
ingredients?
that yeah, there's a really trust is iffy at that crisis moment, but open mind is what is needed for everyone. Because as a health department, we don't know the operations of the company, just like they don't know how we could help them with during deal with the recall and the foodborne illnesses out there. So it's an open mind to learn about each other, to really talk to each other about like what could be done.
Great point. Great point. All right, welcome back. We are here. This is episode 2 with Vivien McCurdy. We're talking about health department at the state level. We're talking about recalls. But you in episode 1, you started to talk about the idea of what a health department is going to continue to do with a food company after a recall, or after it is declared to be over, that you're still going to be finding ways to make sure that I would assume that a company is not going to get right back into that problem again, that idea of an error carried forward, if you will.
Mhm.
So you're sharing from the health department perspective. What are some things that a health department would be doing or looking for perhaps after a recall?
Well, so at Pat, when we kind of talk about, we kind of work together with the company to conduct the recall, notify the consumers, and sending the message out so the retail company can pull the products back, or the consumer can throw away the product from the fridge and all those stuff. So what is really happened after the recall went out? They released the recall only once, and then a week later, like it kind of disappeared. No one really follow up on it. But what we actually still working on as the health department is there's a few things we do. First of all, we do something called the recall audit. So what we do is we work with the company and say, okay, we know you call your consumer, you call your customers. Have you figured out how many of them respond to you and give you the products back, or follow your instructions to discard the product? And then they kind of give us some ideas. So if we notice the company say, oh, we just sent it out, we haven't heard back from anyone, and then that's first thing we will do is, can you please send your message out again, so make sure that your consumer knows, your customer knows that there's a recall on your product. Some
And,
people
and
may
hold on,
not.
hold on. This could be to retailers, to restaurants, to
Mhm.
distributors, to warehouses. It's not necessarily to the consumer at home, correct?
uh there's a couple times we did it at a consumer at home.
Okay.
Yeah, but those are really special circumstances, those we really needs to know, because sometimes what we find out is because of online shopping.
Oh, yeah, yeah, yeah.
So I may be buying a dozen of something from a warehouse, and then they ship it to me as an online product. So then we will say, hey, can you please reach out to the one who buy direct from you, and making sure that they discard the product and all those stuff. So audit check is one thing that we often do after the recall is done. We want to make sure it's effective. We call it the effective audit check. And if we don't see the recall rate come back as we're hoping for, that's when we ask them, can you do it one more time just to make sure things happen, especially the high risk population facilities like daycare, school, nursing home, or
Yeah.
hospital.
Yeah.
If they don't call you back or they don't give you the product back, that's when we got really worried. So that's kind of one thing that we do as an audit check. The second things that we do is we will, depends on what caused the product being a concern, we will continue to work with the company and say, okay, this is what caused the problem last time. You have a failed HACCP plan or one of these preventive step is not effective. How are we going to fix that?
It could
And
be
then they will,
it could be sick employees,
absolutely, absolutely. And
like an norovirus type situation.
um, norovirus,
Yeah.
hepatitis
Yep.
is a big one. So those are the things that we like. How did you address the issues? Did you redo your did you work together as a team to update your SOP, update your HACCP plan? Did you try it again to make sure it's okay? Um, and then good chances we will go back a month, 2 months if we have to. Every month we go back until the problem is solved. So we kind of continue to work with the company to make sure that whatever the problem that they had is now no longer exists, and then we can be all making sure the product is good, and then we will go back to the normal inspection schedules, which most of the manufacturing firm will be like every 2 3 years and those kind of things. So those are the things that as a health department we continue to observe to make sure that the company is doing okay.
So is this sometimes where you'll see perhaps a recall has been expanded with continued
Oh,
work with the health department?
um, because it's been expanded.
Yeah, like they
No.
initially said that we're going to recall, I'm making up numbers. We were
Yeah, yeah, yeah.
initially going to call recall 2 million pounds, but now we're going to extend the recall to be 7 million pounds of this product or 7 million, units or something like that because we didn't realize the problem was as big or had been around for as long as it had been. Is typically through the work with the health department that you might find that the size or the scope and scale of the recall has to be expanded?
Yeah, and it haven't happened to me. Like I have not encountered those cases, but I do aware that sometime when a recall happens, and they thought it's just a really small product, and before we know, it was like getting bigger and bigger, and then different facilities have the same problem because of the ingredients
Yeah,
or
right.
employee sickness. Usually it's like at one place, but when you have one contaminated product you produce and then you shipped it to 4 or 5 out of your facility, they package it for you, then now we suddenly the recall got really big. And we will continue to work with them on that. And that is when you've seen a lot more health department, state health department or state agriculture department come together and making sure all the state is ready to jump in to help and those kind of things. So
But do you find that there's times where a company will say, you're just looking out for the best interests of the consumer, you're not looking out for the best interest of my company, but in reality, your
we
thought
are.
is that if you are looking out for the best interest of the customer, the consumer, then you are looking out for the best interest of the company.
Absolutely, absolutely. And when as a health department, we making sure everyone is healthy, and that's our mission, that's our priority. We want to make sure that no one gets sick from especially preventable illnesses. But at the same time, when we come and when we say we're willing to work with you and then let's get this product out of the marketplace, we're also protecting the company at the same time, because when you have when you have people getting sick, and when more and more people getting sick, the magnitude of the damage just to your company, it's just exponential. And the sooner you work and recall the product, the sooner you contain the damages to yourself and protecting your own self too. So
Well, and it
And
would be a prudent decision to want to be able to use additional resources, aka the health department,
mhm.
to resolve these issues.
Oh, absolutely. And and I want to and this is one thing that I want to say. The health department, we come in as a fresh eye of what's going on, right? Like we are not working in that facility 24/7. Like we don't. And the good thing about the one things that we have, the advantage we have, we inspect hundreds of facilities every year, different kind of operations. So we go in and we can scan, we can get an idea about like what works, what doesn't work, where the weak points are, right? So when you have an organization or a company having a recall, for us is like we go in and we talk to the owners, the QA managers, and then we say, okay, now we get a little bit more idea what's going on. You know, maybe this is an area that you want to look into more because this may be the weak point of your HACCP plan, right? And we can bring in our expertise, like about like what things going on over there.
Sure, sure.
Um, and even though FDA actually have a recall team to help people to draft the recall message and all those stuff. And that's a lot of people don't have that kind of expertise in staff to help them to kind of navigate that system in such a crisis moment. So there's a lot of help over there. And after the recall is when the company um, and the whole staff it just look at what was the problem, what can be preventable, what need to be updated, and then maybe they have to go hire a consultant to come in and help them to retest everything, and that is when you can get the system better and moving forward to have less people less likely to get sick. So
Well, and the probably the biggest component to do that is going to be trust. That idea of earning back the trust of your consumer, of your clients, of your customers, of your even of your own employees at
yes.
your company to that yes, I trust that yes, this happened, but we did the right things. We did everything. We exhausted our resources. We used additional resources. We went through this protocol. We went through and tested this and retested this. We cleaned this. We repaired this, whatever it needs to be, kind of a thing. And now I'm confident as an employee or a leader or a consumer, a customer, that this company will move forward doing the right thing.
Yeah, and if you look at McDonald's, think about it, they just had the quarter pounder. Is not even they didn't grow their onions. The
Yeah,
onion was shipped to them, and then quite a few people get sick and die.
yeah.
And McDonald have done the right thing, and they come out and took ownership. I think Wendy went through the same thing and gained the trust of the consumers back.
Well, unfortunately, though, we do live in a world where there are retailers or restaurants or manufacturers that decide not to do the right thing.
Hmm.
And they kind of, well, what I think is crazy is they don't just hurt their business, they hurt other businesses that are like their businesses because people kind of lump it into the whole thing. It's not just
Absolutely.
one lettuce company or one onion company or one, whatever it is, baby formula to hamburgers. It's like, oh, everyone who does this, or everyone is guilty, or everyone is, acting criminally or whatever. Somehow consumers tend to lump everyone into this kind of one category. And we've seen this time after time where it wasn't just the one company that saw an economic hit, it was the entire product sector took a significant dip that quarter. Even companies that had
Absolutely.
nothing to do with that recall or outbreak.
Well, remember there was one Thanksgiving we didn't even get lettuce on our table.
Well, there were many. There were
Yeah.
a couple in a row. And
Yes,
but that was also a traceability issue in that
it
the
does.
retailers couldn't tell you where they got the lettuce from, and the farms couldn't tell you where it ended up. And so they kind of
Mhm.
said anything from this area. That was the best they could do. Anything from this part of the country, we should not be
So,
eating right now. And
yes.
that that's a very good example of when it now becomes a problem that's magnified
Mm-hmm.
that could have been prevented. And it's again, it's I do appreciate how you talked earlier about just how complicated the industry and the regulatory landscape is around this. But I think perhaps in closing, the idea is that no one should be harmed by food, and
Absolutely.
most people act under this notion that they are doing the right things and that their product is not going to harm anyone. But unfortunately, the reality is that sometimes things that are even out of our control happen,
Mhm.
and that it's not that we're to be measured by what happened as much as we should be measured by what we do as a result of what happened.
I totally agree with that. And one thing that I want to add, again, back to as a team, please, please, please reach out to your state Department of Agriculture, Department of Health, work with them, get to know them, learn about like how's the whole task force work and how you can be a member. Because the thing is like if it hit one company in the state, good chances there's many company in that same state is going to be having the problem at the same time. So it's a food business. We are already in a very complicated, complex, and a very low margin business. Work together and let's thrive together.
Great point. Well, Vivien McCurdy, food safety and public health extraordinaire, recent MSU graduate, thank you very, very much.
Well, thank you so much for having me today, and I'm excited. And feel free to reach out if you have many more thoughts.
Excellent. Thank you very much.